Have you ever had trouble peeing and immediately thought, must be my prostate? Well, here's the thing. Studies show that over 60% of men over 50 are misdiagnosed, simply because doctors are looking in the wrong place. Now, here's the shocking truth. It's not always your prostate. It's actually your bladder, the hidden culprit behind urgency, leaks, nighttime trips to the bathroom, and that constant fatigue that just won't go away. And in minute 4 of this video, I'll show you a simple, completely natural way to retrain your bladder, so you can finally take back control. Don't skip this. The next 30 seconds might just change the way you understand your body. I'm Dr. Thomas Blake, a geriatric specialist with over 20 years of hands-on experience helping men deal with nighttime urination, leaks, or feeling like they have to live life always near a bathroom. I made this video because too many men, especially over 50, are being misdiagnosed, mistreated, and left struggling for years, all because everyone keeps pointing the finger at the prostate. Today, I want to help you see things more clearly and find the right path forward for what you're going through. I want to start today's conversation with a very simple, real-life question. Have you ever had trouble urinating, maybe a weak stream, or waking up multiple times at night just to go to the bathroom, and immediately thought, it must be my prostate? If you've ever thought that, you're not alone. In over 2 decades of being a doctor, I've seen hundreds, maybe even thousands of men over the age of 50 walk into my clinic with the same concern. Doc, I think there's something wrong with my prostate. And to be honest, that's also the first thing a lot of doctors think about. Why? Because around this age, the prostate usually enlarges. It's a natural part of aging in men. But here's what I want you to remember. Just because it's common doesn't mean it's the only reason. And this is exactly where many people take a wrong turn. I remember a patient of mine. His name was Raymond, 67 years old, from New Jersey. He came to see me because he couldn't go anywhere for more than 20 minutes without needing a restroom. At night, he was waking up 3 or 4 times. He was tired, irritable, and said he felt like he had completely lost control of his own body. He had tried prostate medications, changed his diet, even considered surgery. But nothing was working. That's when we started looking in a different direction, one that most people overlook, the bladder. You see, one of the first lessons I learned in medicine was this. Just because something is common doesn't mean it's the cause. We're used to blaming the prostate because that's what we hear about most. But sometimes what's really causing problem is the part nobody's talking about. And the bladder is a perfect example. Think of it like this. The prostate is like a ring that sits around the base of the bladder. If it gets larger, it can squeeze the urethra and slow down the flow of urine. Yes, that's true. But the bladder? That's the muscular pouch that stores your urine, contracts, controls, and manages the whole flow. And when it's not working properly, even if your prostate is perfectly normal, you're still going to have problems. Unfortunately, a lot of people miss that. Too many doctors focus only on PSA tests, ultrasound of the prostate, but never ask about the urgency, the frequency, or those little accidents that happen before you make it to the bathroom. But those little things, they're the bladder's way of crying out for help. Raymond, once he was properly diagnosed with an overactive bladder, was able to turn his life around. Without drugs, without surgery, just by listening to the right organ. I'm telling you this not to worry you, but to help you understand. Not every urinary issue comes from the prostate. Sometimes we need to stop and look a little wider. So if you're going through something similar, frequent trips, urgency, waking up all night, stay with me. Because in the next part of this video, I'm going to show you exactly how to tell whether your symptoms are coming from your prostate or your bladder, and what the right next step should be. For you, I wanted to take a minute and think about the last time you went to pee, not to overanalyze, but just to listen to your body. Did you find yourself standing there, waiting for the flow to start, weak, slow, like a faucet someone's pinching shut? Or maybe you had just sat down to relax, and out of nowhere, this sudden urge hit you like an emergency alarm, and you had to jump up and rush to the bathroom? Now, those two sensations, they may sound similar, but they come from 2 completely different stories. If the issue is your prostate, well, I like to describe the prostate as a tiny gate, sitting right where the bladder connects to the outside. And over time, that little gate slowly tightens. Here's what I often hear from my patients. Doc, I have to wait 10 to 15 seconds before I can even start peeing. The stream's weak, like a drip, and I'm standing there for a full minute, still not feeling done. Even after I finish, a few drops still leak out and soak my underwear. If that sounds familiar to you, your prostate is likely enlarged, pressing on the urethra like a clamp. This is a mechanical problem, and it usually develops slowly with age. But if the bladder is the culprit, that's a whole different story. Now, we're not talking about a block stream. We're talking about loss of control. One of my patients, Harold, 69 years old, told me, Doc, I pee just fine. The stream's strong, but the urge hits me out of nowhere. It feels like I'm being pushed. Sometimes I can't even get my pants down in time. That right there is a sign of overactive bladder, where the bladder muscles squeeze too early and too fast, without waiting for the brain's permission. What does that look like? A sudden, urgent need to pee, often out of nowhere, trouble holding it. Sometimes even leaking before you make it, going to the bathroom frequently, even if you didn't drink much, waking up 2 to 4 times a night just to use the restroom. And here's what I want you to remember. Just because you're a man doesn't mean every problem is prostate related. And just because your stream feels normal doesn't mean everything's fine. Symptoms come in different forms. What matters is being able to tell them apart. As a doctor, I don't just diagnose with tests. I listen to how your body tells its story. Sometimes it's the prostate. Sometimes it's the bladder. Sometimes it's both acting up together. But if you don't know which one you're dealing with, it's easy to end up treating the wrong problem. And I truly believe only when you understand your body clearly can you begin to reclaim the control that age slowly tries to take away. So stick with me. In the next part of this video, I'll show you the daily habits, from what you drink to how you sit on the toilet, that are quietly weakening your bladder over time, and what you can start doing today to change that path. I want you to imagine your bladder like a finely tuned machine, and here's the twist. The most important part of that machine isn't the bladder itself. It's the nervous system that controls it. You see, peeing might feel simple, but in reality, it's a result of a complex symphony between your brain, spinal cord, nerves, and even the pelvic floor muscles. When everything's working in sync, you can hold it when you need to hold it and let go when the time is right. But over time, that harmony can start to break down. I once treated a patient. His name was Walter, 74 years old. Used to be strong, active, full of energy. But after a minor stroke, he started experiencing sudden urges to pee, with no warning at all. He looked at me and said, Doc, I can't even get up from my recliner in time. It's like my bladder has a mind of its own. That line stuck with me, because he was right. When the nervous system is damaged, from a stroke, diabetes, Parkinson's, or other chronic conditions, the bladder can become rebellious. It stops listening to commands, and you lose control. But here's the strange part. A lot of people develop overactive bladder even when there's no clear nerve damage. Why does that happen? Well, we don't have all the answers yet. Medicine is still trying to figure that out. But there are 3 common patterns I see again and again in my patients. First, weak pelvic floor muscles. You know those muscles you squeeze when you try to stop midstream? They're like a door holding the flood back. But when that door is weak, it only takes a tiny contraction and boom, you leak. Second, the everyday things we eat and drink that most people don't even think twice about. Caffeine in tea, coffee, even decaf, is a strong irritant to your bladder lining. It makes the bladder more sensitive, more twitchy. Alcohol, spicy foods, citrus fruits, fizzy drinks, and even artificial sweeteners all act like little itchy triggers that make your bladder react more easily. And third, and this might sound counterintuitive, water. Many of my patients tried to save their bladder by drinking less, but concentrated urine? That's actually a strong irritant to bladder wall, like pouring mild acid on your skin. It still stings. On the flip side, Others go overboard, walking around with a 2-liter bottle like they're training for a marathon. And the result? The bladder never gets a break. You see, the body doesn't always need to be seriously ill to cry out for help. Sometimes it just needs to deal with the wrong little habits, repeated daily, and eventually it pushes back. And when that happens, you'll feel it. You'll know it. But don't worry. In the next part of this video, I'm going to show you how to take back control. Not with pills, but with small changes you can start this very week. Have you ever felt like you're living your life based on where the nearest bathroom is? I'm not asking to be funny. I'm asking because so many people have told me that exact thing. One of my former patients, Bernard, 68 years old, a retired math teacher, once said to me, "Doctor, I don't plan my day by the hour. I plan it by the distance between public restrooms." And I get it. When your bladder's out of control, it can feel like your life doesn't really belong to you anymore. But here's what I want you to remember. Medication isn't always necessary. And sometimes it's the simplest things that make the biggest difference. I usually start with lifestyle adjustments because that's the foundation every treatment needs. If you remember from earlier, I mentioned some of the bladder irritants like caffeine, alcohol, spicy foods, carbonated drinks, and artificial sweeteners. Cutting back on these is like cleaning the room before treating the wound. It's simple, but surprisingly powerful. At the same time, pay attention to your water intake. Don't drink too much, but don't drink too little either. Your body and your bladder need to be watered consistently, not flooded, not dried out. I often tell my patients, space your water throughout the day, just like you water a plant, a little at a time, enough to thrive, but not drown. Now here comes my favorite part, bladder retraining. It might sound strange, but your bladder is made of muscle, and muscle can be trained. I usually start with a simple journal. Write down the times you urinate throughout the day. Then gradually stretch the time between trips. At first, maybe just by 5 minutes. Next week, add another 10. And over time, you teach your bladder to be patient, just like training a puppy. Wait a little longer. Not yet. This takes time. Not days. Sometimes weeks. But I've seen men who thought they were helpless take road trips again without mapping every restroom stop. And they did it without pills. Now, of course, sometimes medication is necessary. If your bladder spasms are too strong or too frequent, and lifestyle changes aren't enough, we may consider bladder relaxants like solifenacin, toltrodine, or oxybutynin. They work, but they come at a cost. Dry mouth, constipation, blurry vision, confusion. And one of the things I worry most about in older patients is falls. Another gentler option is mirabegron. Fewer side effects, but it can raise your blood pressure. So medication is never one size fits all. It requires close monitoring. But above all, here's what I've learned from working with hundreds of patients. You are not powerless. You just haven't rediscovered a strength that was quietly forgotten. Whether you start by cutting out an irritant from your meals or simply keeping a bladder diary, I want you to know this. You can do this, and you are not alone. In the next part of this video, I'll talk about what not to rush into when treating bladder problems, especially the PSA test for prostate issues that too many people either worry too much about or trust too blindly. Let's walk this journey all the way to the end, because aging should not mean giving up your freedom. I want you to imagine an old-fashioned clock, not just the hour and minute hands, but the entire inner mechanism, gears, springs, axles, everything working together in perfect harmony to tell the right time. Our bodies are the same. Very rarely does a health issue come from just one single cause. And this is especially true when we talk about urinary problems in older men. I once had a patient, 73 years old, a retired Navy veteran, who came in with 2 clear complaints. He said, "Doc, I pee slowly in dribbles, but I also can't hold it. Sometimes I just finish and already feel like I need to go again." Right away, I knew this wasn't just a prostate issue. And it wasn't just an overactive bladder either. It was both working together, causing chaos. And that's something a lot of people overlook. The prostate, as I said before, is a small part, but a powerful one. When it enlarges, it presses on the urethra, making the stream weak, making it hard to start, causing dribbling and that feeling of never quite being done. But at the same time, the bladder, after being pushed and strained for so long, constantly fighting against that obstruction, starts to push back. First it stretches, then it loses patience. Then it starts squeezing at the wrong times. So now you're stuck with this strange mix. You have to strain just to get started, and yet you also feel like you can't hold it. Sounds contradictory, right? But I've seen this exact situation time and time again. And the dangerous part is this. If you only treat one side of the problem, you never really get better. I often compare it to driving an old car. Your brakes are sticking, and your gas pedal is way too sensitive. If you fix the brakes but ignore the gas, you're still out of control. If you ease the gas but forget the brakes are failing, you're headed for trouble. It's the same with the prostate and bladder. A lot of people are told you have an enlarged prostate, and they jump right into medication, even surgery. But the symptoms don't go away. Why? Because the bladder has been mistrained for too long, and it needs to be retrained, not just with meds, but with your patience and your understanding. I'm not sharing this to make things more complicated. Quite the opposite. I want you to see the bigger picture. If your symptoms don't quite match what the doctor said, that doesn't mean you're wrong. It might just mean two systems are acting up at the same time. And when you realize that, you won't feel so lost in a maze of test results or prescriptions. You'll start to see what you actually need. And from there, you'll make the right choices. We can't reverse aging, but we can take back control of our bodies by learning to understand them like an old friend, maybe a bit cranky sometimes, but always willing to listen if we know how to talk. In the final part of this video, I'm going to tackle one of the most controversial topics in men's health, the PSA test. Should you get it? When is it actually necessary? Stick with me to the end. Don't give up, because no one deserves to live with discomfort just because they misunderstood their own body. I want you to picture this. It's just an ordinary day. You go in for a routine checkup. Everything seems fine. Then the doctor asks, "Would you like to do a PSA test?" And just like that, one simple question can open the door to peace of mind or months of unnecessary anxiety. PSA, short for prostate-specific antigen, is a protein produced by the prostate gland. When PSA levels rise in your blood, it can mean something's going on, inflammation, benign enlargement, or in some cases, prostate cancer. Just hearing that can make anyone worry. And I get it. One of my patients, Gerald, 66 years old, said this after his first PSA test. "Doc, ever since I found out my PSA was high, I haven't had a good night's sleep. It feels like I'm walking around with a ticking time bomb." Then came the follow-up tests, the biopsy, the long wait for results, and finally, the conclusion, no cancer, just a slightly enlarged prostate, which is perfectly normal for a man his age. You see, PSA isn't a perfect test. It doesn't tell you if you have cancer. It just tells you that something is different. And different doesn't always mean dangerous. For a long time, I hesitated to bring up PSA with my patients. But eventually I realized the issue isn't the test itself. It's the expectation. We expect PSA to give us a clear answer, when in reality, it often just raises more questions. For some men, especially those with family history of prostate cancer or clear symptoms, PSA can be a valuable tool. But for others, healthy, symptom-free, with no risk factors, PSA can pull them into an endless cycle of tests, fear, and medical decisions they might not need. I'm not saying this to scare you off from getting tested. I'm saying it so you know you have the right to ask, the right to pause, and the right to choose. If you're wondering whether or not to get a PSA test, my honest advice is, don't rush. Watch the next video I made specifically about PSA testing, where I'll break down who should consider it, who probably shouldn't, and most importantly, when it is actually the right time to do it. Medicine isn't just about numbers. It's a balance between science and emotion, between knowledge and trust. And I believe when you have the full picture, you'll make the decision that's truly right for you, not out of fear, but because you understand your body better than ever before. I want you to picture this. What you just heard today, it's not just about the bladder or the prostate. It's part of something bigger, a story about understanding your body more deeply after 60, about tuning into the small signals we used to ignore, and about reclaiming control in a gentle but intentional way. You've learned how to tell the difference between prostate-related issues and signs of an overactive bladder. You've learned how to adjust your lifestyle, rebuild healthy bathroom habits, and even retrain your bladder like you would exercise a muscle that's forgotten its job. You've also heard the caution about PSA testing, and you now know that sometimes the more important question is, should I get the test at all, rather than just going ahead and doing it? The message I want you to carry with you when this video ends is this. The discomforts of aging are not inevitable, and you, whether you're in your 60s, 70s, or beyond, can still live with confidence, clarity, and a deeper understanding of your body than ever before. Your body has carried you through decades. Now's the time to become a kinder friend to it, through knowledge, patience, and proactive choices. Before we wrap up, I want to ask you one thing. Where will you start today? Is it cutting back on coffee, writing in a bladder journal, or maybe doing a quick pelvic floor squeeze right now? Just one small step can open the door to a big change, and I'd love to hear which step you're taking to reconnect with your body. If this video was helpful, don't forget to give it a like, subscribe to the channel, and turn on the bell so you won't miss future videos on men's health over 50. And if you're still unsure about the PSA test, whether it's truly necessary or just another source of stress, be sure to check out the next video I've made. PSA, false alarm or life-saving test. I'll walk you through how to make the right decision, not out of fear, but from a place of understanding. Leave a comment below. I read every single one. Because health isn't a lonely road. It's a journey we can walk together.